Hi everyone, I'm here. As a family physician with over 20 years of experience, I've seen my share of childhood illnesses and injuries, and some of them are really scary. Like the first time I saw a child with a really bad case of croup. Have you ever heard of croup? Well, if you have a child, or you're around children a lot, you probably have. Croup is a viral infection of the upper airways that causes a distinctive barking cough. It can be really scary for parents when their child develops this severe cough and they might think it's the end of the world. But in most cases, it's not. In fact, croup usually resolves on its own within a week or so. But there are some things that parents can do to help their child feel better while they re-sick. First, let's talk about what causes croup. As I mentioned, croup is a viral infection. That means it's caused by a virus, not bacteria. The most common cause of croup is peri-influenza virus, but there are other viruses that can cause similar symptoms. The virus usually enters the body through the nose or mouth, and then travels to the vocal cords, where it starts to replicate. This causes inflammation of the vocal cords and the upper airways, which leads to the characteristic cough of croup. Now let's talk about the symptoms of croup. The classic symptom of croup is a harsh, barking cough that sounds like a seal. Other symptoms include a runny nose, sore throat, and fever. In severe cases, the child may also have difficulty breathing, and their breathing may be noisy. One of the scariest things about croup is that it can quickly become very severe. If you're concerned about your child's cough, please seek medical attention right away. Croup is most common in children ages 6 months to 3 years. And although it's more common in the winter months, it can occur at any time of the year. If you suspect your child has croup, please take them to the doctor right away. Croup can be serious, but it's usually not life-threatening. There are some things that can make croup worse, such as asthma or a bacterial infection, so it's important to get checked out. A doctor will listen to your child's lungs and ask you questions about their symptoms. They may also perform a test called a steeple sign, where they shine a light into your child's throat to look for a specific pattern of inflammation. This can help determine the severity of the croup. In most cases, croup will resolve on its own within a week or so. But there are some things that parents can do to help their child feel better. First, make sure your child gets plenty of rest. This will help their body fight off the virus and recover. You should also make sure that they're drinking plenty of fluids. This will help keep them hydrated and prevent dehydration. If your child is old enough, you can give them over-the-counter medications such as acetaminophen or ibuprofen. These can help reduce fever and inflammation and make your child more comfortable. There are also some things that you can do to help relieve your child's cough. One is to try cool mist or steam. This can help loosen mucus and soothe the throat. You can use a cool mist humidifier or simply run the bathroom faucet and let your child breathe in the steam. Another option is to give your child a warm bath. The steam from the water can help open up their airways and make it easier to breathe. You may also try putting a cool, damp cloth on your child's chest. This can help reduce inflammation and relieve coughing. If your child is having trouble breathing, you may want to try having them breathe into a paper bag or plastic bag. This can help increase the amount of carbon dioxide in their lungs, which can relax the muscles in their airways and make it easier to breathe. If your child's croup is caused by a bacterial infection, they may need antibiotics. This is why it is important to see a doctor, so they can determine the cause of the croup and provide the appropriate treatment. Remember, croup is a common illness that can be scary for parents, but it's usually not serious. By following these tips, you can help your child feel better faster and make the croup experience less stressful for everyone involved. Thanks for watching. Please like and subscribe. And always remember to consult with your child's pediatrician for any health concerns.